Origin of trapezius. Medial 1/3 of superior nostril line. External occipital protuberance and ligamentum nochae. It extends till C6. Then from C6 to T12, it attaches to vertebral column. Insertion of trapezius. Posterior aspect of lateral 1/3 of clavicle and medial part of acromion and upper lip of crest of spine of scapula. Cranial nerves are 12 pairs. 11th pair is called as accessory nerve. It has two branches. One is spinal part of cranial nerve and another one is cranial part of cranial nerve. Spinal part of cranial nerve gives the supply to trapezius and it is motor neuron. Another one is sensory neuron which comes from C3 and C4. Stop. Actions caused by trapezius. It has three fibers: upper fibers, middle fibers and lower fibers. Upper fibers along with levator scapulae causes elevation of scapula. Middle fibers along with the rhomboid minor and rhomboid major causes retraction of scapulae. Lower fibers along with serratus anterior causes depression of scapulae and overhead abduction, which is above 90-degree abduction.
This is levator scapulae. It originates from transverse process of C1 and C2 and posterior tubercle of the transverse process of C3 and C4 vertebra, and it inserts in superior angle and upper part of medial border of scapula. And nerve supply to levator scapula is C3 C4, and it assists upper fiber of trapezius to elevate the scapula. And next we have rhomboids major and minor. Rhomboid minor originates from lower part of ligamentum nuchae, spines C3 and T1 vertebra, and it inserts in base of the triangular area at the root of the spine of the scapula. This is the root. Here it inserts. And rhomboid major. This is rhomboid minor. It originates from lower part of ligamentum nuchae and spines of C7 and T1, and it inserts in base of the triangular area, upper part of medial.
Deltoid muscle. Its origin: anterior aspect of lateral 1/3 of clavicle, lateral border of acromion, lower lip of spine of scapula. Insertion: deltoid tuberosity of humerus. Its nerve supply: axillary nerve C5 C6. Actions: flexion and medial rotation by anterior fibers, abduction by middle fibers, abduction 15 to 90 degrees, extension and lateral rotation of arm by posterior fibers.